So you have heard so much about the need to keep an eye on your numbers, do blood tests, ensure everything is running smoothly. Well, you may not have any symptoms, but you may want to get some blood tests. So which ones should you ask for? How often should you do them? Today, I will explain some blood tests and why you should do them. My name is Dr. Adeze Fezulike. I'm a lifestyle medicine doctor and GP. Welcome to my channel. Oftentimes, patients come to see me and they say something like, Doctor, I want a full body check, or Doctor, I want to do tests. Well, there are 1,000 blood tests, and the NHS wouldn't allow us to run 1,000 tests on an individual. We have to narrow things down. So the importance of knowing what you need to check is that if you do unnecessary tests, you may get results that simply cause you more anxiety, results that can't even be interpreted and show that you shouldn't have done those tests in the first instance. So endless tests are not recommended. Also, doing tests that way is not cost effective for the NHS or for you if you're paying privately. So a good doctor should take a history from you, ask about any symptoms you're having, and also any family history of illnesses which you may need to be checked out for. Then there should be a physical examination. This will focus on specific areas of complaints you may have mentioned, and also on other important general areas like taking a blood pressure. So supposing you have turned 50, you're completely well as far as you can tell, and no particular symptoms apart from maybe some tiredness. You haven't done blood tests for 10 years and would like to do some tests. The first set of tests should always include a full blood count, okay? This measures the number of red cells, white cells, platelets, and other important cells in your body, and also their sizes, the actual sizes of the cells. So this one test can tell the doctor if you have excess of cells, which may suggest a blood cell disorder like leukemia. It also tells if you have anemia. Most women are anemic due to years of having periods. You're having your menstrual period. This can make you weak. Now, if cells are larger than normal in size, this may suggest lack of important vitamins like vitamin B12 or folic acid. So full blood count is a good test to do. Secondly, ask for a liver function test. The liver is our largest organ apart from the skin. It plays a crucial role in detoxifying the body, in breaking down medication, producing enzymes to help us digest food. So an abnormal liver test can tell so many things. If you're living with obesity, your liver test may be abnormal because some of the fat has taken over the liver, which is not good. A liver test may be abnormal in infections of the liver, like with a virus like hepatitis virus, some medicines, some herbal preparation. All this can damage the liver. Yellowness of the eyes, called jaundice, may also indicate liver damage. Thirdly, ask your GP for a kidney blood test. The kidneys are so important. They act as filters to remove unwanted substances from the body, including excess water. Abnormal kidney tests may explain why you have leg or facial swelling due to retaining fluid if your kidneys are not working well. Some medicines also damage the kidney, and the kidney can also be damaged from recurrent kidney infections. Conditions like diabetes may damage the tiny filters and vessels in the kidney. So diabetes is actually the greatest cause of kidney failure. Now, fourthly, ask for a blood sugar test. You do not have to fast for this. In the UK, it's estimated that more than 1 million people have undiagnosed diabetes. And in the USA, nearly 9 people have undiagnosed diabetes. So one may be diabetic and not even know. So ask for a blood sugar test. Generally, if you get a random person in the street and you test them and their blood glucose level is more than 11 millimoles, then they are likely to be diabetic. We can then do specific tests to confirm this. So the fifth important test to do is a thyroid blood test. The thyroid is an organ in the neck. It powers up the system and controls how our bodies use energy. If your thyroid gland is not working well, you will likely be tired all the time despite sleeping enough. So these are really basic blood tests everyone should do. A full blood count, a liver test, a kidney test, a blood sugar test, and a thyroid test. And the good news is that these tests are so straightforward, can be done in any good laboratory. Now, there are several other blood tests one could do. For instance, if you have a family history of people having heart attacks in their middle age, then you should get a lipid profile checked. This tells about the levels of the different cholesterol in the bloodstream, and some studies have linked the so-called bad cholesterol to heart disease and stroke. So you should ask for this test if, for instance, your father or your uncles had a heart attack or stroke or died suddenly in their 40s or 50s or 60s. If you're a man listening to this and you've never had a prostate blood test, this is a good time to ask for one. A prostate blood test is not specific for prostate cancer. However, if the prostate blood test is normal, that provides some reassurance. This test can always be repeated if you start having prostate symptoms like difficulty passing out your urine, or you're only passing dribble, small amounts of urine, then you should check again. Now, apart from blood tests, another important thing to do is a stool test. Once you're in your 50s in the UK, you will get a test kit in the post. I got mine the very week I turned 50. Now, this stool test is simple to do. They require just a small amount of your stool to send to them, and they will check it for hidden blood. This is blood that you may not even see. It's hidden blood, okay? If there's hidden blood in your stool, then you'll be invited to have them pass a camera into your bowel to check for things, why are you having blood in your poo? They will check. And sometimes bowel cancer has been discovered in this way. So please always do your stool test. Don't discard the letter or plan to do it after your Christmas shopping trip. Everyone poops every day, or at least every second or third day. So just get some poo and send it away. Do not delay. Now, for the ladies who are in their 50s, you should also get a letter asking you to get your mammogram done. My friend's breast cancer was picked up this way. She went for a routine mammogram and was found to have cancer. She had not even felt a lump. Thank God for the mammogram, which picked up this cancer early. So please get your mammogram done once you're 50 years. And at any age, if you notice anything unusual with your breast, go check it out. So I hope this provides a basis for discussing with your GP and requesting blood tests. Your GP may suggest other tests depending on your history or what they find on examining you. So just to give you an update on my last video where I told you I was doing a 3 days fast, just drinking water, you can watch the video here. Well, I finished the fast. It was super easy. I was strong throughout and simply kept out of the kitchen and drank water. If you find that you're struggling, do have a glass of fresh juice with a small pinch of salt in it, or a small cup of meat or chicken broth, okay? You will find that refreshing and will be able to continue your fast. Always check with a physician before starting an extended fast if you have any underlying health issues. So till we meet again in my next video, bye for now.